Hello, everybody. Just an update on some of the news that's happening around the world of local motorsport that you might not know of, and that's the involvement of leading motorsport teams in the battle against the current coronavirus and in using their skills in fast prototyping, design, and manufacture to come up with new and innovative ideas to help health workers at this time of crisis. Now, in the United Kingdom, the 7 locally based Formula One teams, including teams like McLaren, Williams, Mercedes, Renault, are all getting involved to produce ventilators and other equipment through a project called Project Pit Lane. Now, here in Australia, supercar teams are doing the same sort of thing. This morning, Erebus came out and announced that they've been involved in the design of a couple of pieces of equipment for local medical work and local hospitals in order to hopefully make their work a little bit safer. Now, this afternoon, Erebus, Barry Ryan, the CEO of Erebus Racing, and also the supercar medical officer, Dr. Carl Lee, got together for an online media conference, and I thought we'd take you there. We joined that media conference, and we thought we'd take you there and show you and exactly what the guys are doing. So this is a little bit earlier this afternoon, and we start off with Barry Ryan to talk about exactly what Erebus have been doing and how they got involved.
Basically, last Wednesday, Mirko approached myself and Betty and Dennis about an idea he'd seen in Italy, because he's got some family back in Italy that are under isolation, and it's not very nice over there at the moment. He just had some things he wanted to contribute, and he's been doing pretty hard for a few weeks now, like we all have, but he's more hard than most of us because it's really hit home with him. And so we thought, let's give it a crack. Well, so we forwarded it on to Dr. Carl and just asked what he thought, and pretty quick it turned into a massive conversation about what the potential was and what the options were, and then it turned into other things that Dr. Carl had seen himself that he would like to get manufactured and trialled. So, it's still going on up to today with some communication things we're now working on, and we've now introduced all the supercar teams into it to use their resources where we can. And so we're into full production on some of the things now to make sure that they're available when people need them, and when Dr. Carl works with his colleagues to make sure that they're actually exactly what they need. But it's looking pretty positive, and we're not trying to save the world. We're just trying to have some options there that, in case it gets to a point where they run out of the normal parts they use.
Dr. Carl?
Yeah, good afternoon, everyone. Thanks for your interest and thanks for being here. So as Barry said, literally it was on Wednesday that I spoke to Barry for the first time. I've been working in supercars for 13 years, but I never really spoke to Barry except for when David Reynolds crashes or so. But more seriously, I work in Melbourne. I'm in 2 emergency departments that are private hospitals. We're a few weeks behind overseas, so we know that there's a storm coming. We don't know the size of this storm. Some people are calling it a tsunami. I think we're in a better position than overseas. We don't predict that we're going to run out of ventilators and such. However, you can never be too sure. A lot of this COVID-19 crisis is, I try and help people by saying that there's so much we can't control. There's so many things we can't fathom. It's so hard to understand. We don't know enough about the virus. But then once we go through all that paranoia and anxiety that I've been going through myself, we then get to focus on ourselves and, what can we do to protect ourselves, our family. And we already all know the catchphrases of stay at home, stay away, social isolation, social distancing. I believe there's going to be a more serious announcement about stage 3 restrictions starting this evening. That will all help reduce the numbers, flatten the curve that we all know about. But when Barry contacted me, it was a really opportune time, and he and I have been on the phone and such constantly over the last 4 days now, because we have both the same idea, which is that we just want to do something. In the medical world, it's quite often very difficult. There are a lot of committees, there's a lot of authority that needs to be given before anything can be used. Being there myself, I can see the current needs. And so when Barry contacted me, I modified what the initial approach was to focus on 2 preliminary things, but now we've moved on to 4 things that we've identified that could possibly help. We have to really say importantly that these are not commercial ventures. We stand nothing to gain from this, quite the opposite. we're investing our time and money. Thank you, Betty Clemenco, for funding this as well in this preliminary stage, just to get it out there. So Barry and Erebus are providing the design, the fabrication, the manufacturing, and all the collaboration and relationships that they have through the motorsport world. I'm providing what I can in terms of my contacts in the medical world and the healthcare industry. As the Supercars medical delegate, I've travelled the nation for the last 13 years in this role, meeting doctors from around the country in each state and territory, not ACT, but Northern Territory. So I do have local contacts there. So, we're trying to get this information out. So if we go back to the initial approach, which was Mirko has relatives living in Milan. They're all quarantined. There are horrible photos of pictures from ICU, and there are some, but there are some positive things where, because they're running out of ventilators, they are using these Decathlon snorkeling masks, which are full face, very well engineered to work underwater. They have both an inspiration and expiration channel on them, and so now they've what they did over there was to 3D print an adapter piece that goes on the top of the helmet. I actually got one here that I can show you. So this is the unit that we're talking about. And up here, what we have is this black piece. So they've been adapting these to be able to fit and use this retail mask, which in Australia retails around $35. Before you can't buy them now, but before they were $35, to then be able to use them for what's called a CPAP mask. CPAP mask, ventilators, that's much higher end, and because it's being used by the patient, there are hurdles, there are authorities and steps that need to be progressed before they can be used in that way. Having said that, Mirko has finalising the 3D CAD design of the adapter piece so that it can be downloaded, can be printed by end users if that's wanted then. But what we quickly moved to is whether this could be used as personal protective equipment. Again, this is not to replace anything that we already have. It's to supplement what we have. It's another piece of armory. That's another thing we have at our reach to use if a healthcare worker chooses to use it. These are snorkeling masks. These are not medically designed masks. The company makes that very clear. However, within the last 4 days, Barry's been able to get onto Decathlon. They're now stopping all sales online, and I believe in their department stores, of their stock of masks to reserve them for medical need. They're in direct communications with Barry, Monash University, Freddie company, printing company called Cobalt, to then work on these technologies to be able to make these adapter pieces. This isn't just a Bunnings tube. This has actually been 3D designed with 3 compartments in here. This is version 1 because we've moved on to version 2 where we've separated the 2 channels, and we now have 2 filters at the back, where these are commercially available P2 filters, which are the equivalent of N95 filters, which means they filter out 95% of particulate or viruses down to 0.5 microns. To move on to that, so in this initial phase, in the last 3 days, Barry's gone to obtaining over 300 of these. And our intention is just to send them out for trial, for people to test them, to tell us this is good or it's no good. But we're willing to do that again just to get it out there. The other leading item that we found was when Barry contacted me, I made him aware of a Taiwanese doctor, Dr. Lai Hsien-Yung, who released a document. It was in the media to say that he created this Perspex box, which can be placed over the head of an unwell patient for a dangerous procedure when a patient becomes critically unwell. And a medical person has to do an intubation, which is to put down a breathing tube for them. There's a high risk of aerosolization of the virus, and that exposes the healthcare workers to danger. To minimize that, healthcare workers around the world have modified their intubation techniques. They no longer ventilate the patient just before doing it to minimize aerosolization. And currently the thought is to use a drape over a patient. But this box, I think, has some advantages. It is cumbersome. It is a 3-dimensional box. But what I did when Barry made the first one, within a few hours of having a look at it and seeing how it would work, I saw that there was an opportunity to add suction to the box. So we looked at the available suction that's in intensive cares and emergency departments on the walls behind patients. And what we've done is drilled a hole, fitted an existing, we're trying to keep things simple, fitted an existing outlet, what's a barb, and then we can connect that barb straight into the wall suction, and thereby minimizing the aerosolization getting out into the atmosphere in the room. The current belief is that when a patient with COVID sneezes or cough, the droplets can aerosolize for up to 3 hours. So it's quite a dangerous exposure to healthcare workers. If at the end of the day this box is nothing more than a shield, an extra layer of shielding between a sick patient and the healthcare worker, that's great. The other things, apart from this acute process of intubation, the other instances where I thought this would be useful is firstly when we have to transfer patients between areas. So if a patient is sick and has to be transferred from a ward to an intensive care or from an emergency department to the ward, it necessitates manoeuvring through a corridor. If this box with a drape over it can minimize spread during that transfer, fantastic. And finally, if we have enough and make enough of these, I can see that every patient lying on a bed could potentially have one of these clear boxes. They can still see through, communicate through, breathe through, just to minimize any possibility of aerosolization. So the things we've covered again are the snorkeling mask with an adapter piece with P2 filters. The second thing are these boxes. The third thing is the original idea of the adapter being made for CPAP is going to be made available for other 3D print. And then as of last evening, Barry and I were talking, I was thinking in one of my emergency departments, we have great isolation rooms, but they weren't built or designed for this crisis. And what we lacked was communication inside the room. And this is not uncommon. And I've now seen Facebook posts for staff asking for baby monitors or old iPads that they could use to communicate with patients. If we can minimize interactions between healthcare workers and the patients, for example, the patient needs something, a bedpan or a drink or so, without that healthcare worker having to don full personal protective equipment just to go and answer a question, then come back. If we can minimize the number of times they need to do that, it's clearly safer. So we're looking at solutions. At the moment, we're looking really at a tablet device, which I'll call an iPad for ease of it, an iPad device which can then be used between a healthcare worker and the patient, still in visual contact through a door, a glass door or window, but directly contact and talk, voice activated via a tablet device. Additionally, there's opportunity for this tablet device to be used for that patient to communicate with family. Yes, most patients, younger ones in particular, will have updated Android, iPhone devices, but for those that don't, this may be a simpler opportunity for them to communicate with loved ones when they're in total personal isolation. So that's something we're moving forward to as well. With this media conference, we're really hoping that we don't know all the answers, we don't have all the solutions. We're really keen to hear from other people, what are your needs and in what way we can help. We can't guarantee that we can help. We'd certainly like the opportunity to see if we can use the whole Supercars network of people, my network of healthcare professionals, to see what we can do to help the situation, to prepare what we're expecting to come. Even the simplest little things may make a difference to someone's physical health or mental health. That's what we're trying to achieve.
Yeah, but a question to Barry. The announcement said that you were limited at the moment to about 20 units per day. Is there anything at all that can be done to sort of ramp that up? And is there any role that government could play in helping and assisting in ramping up that production?
Yeah, the 20 a day is purely the manufacturer that we've got doing it. So I've already, since the media went out, we went to all the supercar team owners and we've started a bit of a network of their plastic suppliers, and someone in Brisbane, someone in Sydney, someone in Perth, that we could just send the CAD model to them and they can make them, and then hopefully they're close to a hospital, go and deliver it. That's the ultimate solution, that is minimised freight and there's maximised in manufacturing.
Right, AVL?
So have you guys spoken to every other Supercars team about this, and what's the sort of response been up and down pit lane, so to speak?
Yeah, clearly it only started sort of Wednesday lunch, so we've been flat out trying to just get exactly what we're going to do first. So now, today we've sort of rushed this through because we really want to get it out there so we can get the maximum support. So like I said, I've just sent an email to all the team owners, and obviously they've all started replying with, yeah, we can do this, we can help with this, and there's emails coming through as I'm sitting here. So I'm sure our community of supercar teams and their network of their sponsorship groups and all their partners will be able to help with anything we want, pretty much. So the next couple of days are going to be pretty exciting to be able to get this off the ground and make sure that we can deliver all these things if they're needed.
Carl, how much pressure will this alleviate on the situation around Australia at the moment?
That's a good question. So there's two types of pressure. I think the mental health pressure is huge. The anxiety of seeing what's happened overseas and such. I would say that the pressure, as I said before, it's really the calm before the storm. Whilst we do have positive cases in emergency departments, in intensive care units, it's nowhere like what we're seeing overseas at the moment. So there's more an anxiety at the moment about what's going to hit us. So I guess a lot of what we're doing is to help prepare for that, to help provide what we can provide. So there's a couple of things I can address here as well, which is that we are not in a stage where we're short of things. Australia is much better off. The government, I believe, is resistant to private entities doing what we're doing. I don't believe that what we're doing, we should be approaching the government to interfere with what they're doing and all their strategies. This is to complement those. This is just to run parallel with those in our own small little universe to do what we can do, to provide alternatives and options to make it clearer. In my emergency departments, we are rationalising our use of personal protective equipment whilst it is quiet, to try and store up for when the storm does hit. But even then, so while we're doing all this preparing, what are the other things outside the envelope that we could do? And that's what we're trying to do here, which is provide additional resource, additional options for healthcare workers for managing these patients as they come in. Does that address your question?
Yeah, no, that's fantastic, Carl. Thank you. And Barry, just one for you. Normally, work inside a supercar team is very insular. You're doing work for yourselves, and that's pretty much where it is. The feeling for the team to be doing something for the community like this. Can you take us through that?
Yeah, it's obviously great to be able to provide something when we're not racing, and it's getting our brains into gear. And my head's been spinning the last couple of days trying to, I guess, manage it all because there's so much enthusiasm around it from our small group of guys. Like, we've only got about 4 or 5 key guys working on this because we just don't want too many people getting involved and having to do little errands here and there where we're trying to all stay at home and isolate. So, but we've been not even running into each other. If we run into each other, we're keeping a distance and doing everything we're supposed to be doing. So, but it feels pretty good to be able to contribute. And if nothing comes of it, nothing comes of it. But at least, like Dr. Carl says, we're ready. And if it does, if the shit hits the fan, at least we're going to have some extra things to help out with.
All right. Well, I think that's it then. Everyone, thanks for joining us again on your Sunday afternoon. And if there's anything else you need from us, obviously, Jude and myself from Erebus are your key contacts, and we'll keep you updated as we progress.
Well, the only thing I would say is, with the communication side of it, obviously we're trying to get tablets, and I've spoken to Roland Dane. He's got a pretty good connection with HP. If anybody's got any good connections with Apple, it doesn't seem like anybody can talk to Apple. But if there's any connections with Apple, it'd be great to see if they can help us out with some iPads because it's going to be 200 or so needed, and somebody's going to have to pay for them. So that's a minimum of 200 to try and establish a bit of a base. So yeah, if we can do a bit of a reach out there, which we'll do on social as well, it'd be great. As many of you guys could do the same. We obviously don't want a whole heap of scrap thrown at a hospital that's no good to anyone, but we need to pick a spec of notepad or tablet and just use that one spec and make sure it goes across the whole system.
Cool. Right, anything closing from you, Dr. Carl?
No, appreciate everyone's time, and Barry and I are committed to this. So is Betty, guys at Erebus. It's something positive for everyone to focus towards as well, that we can just do our little bits. So yeah, please help us. That'd be great.
Yes, it's great to see race teams involved in that sort of thing. Motorsport is ideally placed for this sort of thing. You know that particularly in Formula One, someone comes up with a new design of a barge board or a new small winglet somewhere. That within 24 hours, most of the other teams have copied it, produced it, and put it on the car. They can do that sort of thing for desperately needed equipment as well. And as we've seen overseas with people involved in building things like ventilators, in the case of the Formula One teams, and what we saw Erebus doing today, it's great to see motor racing doing its bit to take part. In terms of what's happening on the track, the answer is absolutely nothing, but there's lots of sim racing on. Been watching quite a bit of that, so if you've been watching the sim racing, perhaps you can let us know in the comments below what you think of it. What's your favourite sim race so far? I think so far, from my point of view, the one that really stood out was the Super Sebring that we had last week with the guys from Radio Show Limited, John Hindhoff, Nick Damon and those guys. They did a really good job. They called it, so it was pro wrestling style. They did it kayfabe style. They pretended, they believed it was real, they called it as if it was real, and it made you believe. I mean, you suspended your disbelief for a moment, and it was a very entertaining way to spend a Sunday morning. Also, the IndyCar this morning was very good. Scott McLaughlin again showed his skill. He's made his IndyCar debut, but not exactly the way he planned it, but he finished fourth, and Will Power finished second. Sage Karam was the guy. He just dominated. Sage Karam has been doing sim racing for quite some time now on a number of platforms, and he showed that today with his domination in that particular race. But just to let you know that there will be an edition of In Pit Lane from here, from home, coming to you later on in the week. So we're not sure exactly what we're going to be talking about or who we're going to be talking to, but we will have something. So, but I just thought I'd bring you that from media conference from today because it was interesting to see what they're doing. It's good to see everybody coming together in this particularly tough time. So I hope you're surviving your isolation well. Hope you're doing a lot of work around the house, or perhaps doing a bit of work with your race car. You might as well. It's not going out on the track for quite some time, so you might as well get around to doing those upgrades and those changes that you've always wanted to do. So until we see you again, thanks for joining us, and we'll be up with an update later on in the week, probably Tuesday night at the regular time of 9 o'clock. But until then, thanks for watching, and we'll see you later. Bye for now.